Welcome to our deep dive into understanding what your body is telling you through the signs of vitamin deficiency. Today, we'll explore the essential vitamins your body needs, the symptoms that arise when you're lacking them, and practical steps to address these deficiencies. This is a comprehensive guide, so let's get started. First, let's talk about why vitamins are so critical. Vitamins are organic compounds that your body needs in small amounts to function properly. They play a role in everything from energy production to immune health, cell repair, and even mental well-being. Unlike macronutrients like carbs or proteins, vitamins are micronutrients, meaning you need them in trace amounts, but their absence can cause significant health issues. Let's begin with vitamin A, often called the vision vitamin. Vitamin A is crucial for maintaining healthy eyes, skin, and immune function. It's found in foods like carrots, sweet potatoes, spinach, and liver. A deficiency in vitamin A can show up in several ways. One of the earliest signs is night blindness, where you struggle to see in low light. You might notice your eyes feel dry or irritated, or you're getting frequent infections because your immune system is weakened. Skin issues, like dryness or roughness, can also point to low vitamin A levels. If you're experiencing these symptoms, consider adding more vitamin A-rich foods to your diet or consulting a doctor about supplements. Next, let's move to vitamin B or thiamine. Thiamine is essential for converting food into energy and supporting nerve function. You'll find it in whole grains, pork, nuts, and seeds. A deficiency in thiamine can lead to a condition called beriberi, which affects the nervous and cardiovascular systems. Symptoms include fatigue, muscle weakness, tingling in the hands and feet, and even confusion or memory issues. In severe cases, it can cause heart problems. Alcohol consumption can deplete thiamine, so if you drink regularly and notice these signs, it's worth checking your levels. Vitamin B2, or riboflavin, is another key player in energy production. It's found in dairy, eggs, green leafy vegetables, and fortified cereals. A lack of riboflavin often shows up in the mouth and skin. You might develop cracked lips, sore throat, or inflammation of the tongue. Your skin could become oily or scaly, especially around the nose and mouth. These symptoms are subtle but noticeable if you pay attention. Increasing riboflavin-rich foods can often resolve these issues quickly. Now, let's discuss vitamin B3, or niacin. Niacin supports skin health speaking, digestion, and nerve function. It's abundant in poultry, fish, peanuts, and whole grains. A severe niacin deficiency causes pellagra, characterized by the 3 Ds: dermatitis, diarrhea, and dementia. You might notice a red, scaly rash on sun-exposed skin, digestive upset, or mental fog. Milder deficiencies can cause fatigue or irritability. Since niacin is found in many foods, pellagra is rare in developed countries, but it's still a risk for those with poor diets. Vitamin B, or pantothenic acid, is less commonly deficient but still important. It's involved in hormone production and energy metabolism. You'll find it in almost all foods, especially mushrooms, avocados, and chicken. A deficiency might cause fatigue, irritability, or numbness in the extremities. Because it's so widespread in foods, deficiencies are rare, but processed diets can sometimes lead to low levels. Vitamin B6, or pyridoxine, is critical for brain health and red blood cell production. It's in bananas, potatoes, chickpeas, and poultry. A deficiency can cause anemia, leading to fatigue and weakness. You might also experience mood swings, depression, or confusion. Skin rashes and cracked corners of the mouth are other signs. If you're on certain medications, like those for tuberculosis, you might be at higher risk for B6 deficiency. Vitamin B7, or biotin, is often associated with healthy hair, skin, and nails. It's found in eggs, salmon, and nuts. Biotin deficiency is rare but can cause hair loss, brittle nails, or a scaly red rash around the eyes, nose, or mouth. Some people taking long-term antibiotics or anticonvulsants may be at risk. Eating raw egg whites regularly can also interfere with biotin absorption, so keep that in mind. Vitamin B9, or folate, is crucial for DNA synthesis and cell division, especially during pregnancy. It's in leafy greens, lentils, and fortified grains. A folate deficiency can lead to megaloblastic anemia, causing fatigue, weakness, and pale skin. You might also notice mouth sores or a swollen tongue. Pregnant women are particularly at risk, as folate deficiency can lead to birth defects. If you're planning a pregnancy, ensuring adequate folate intake is critical. Vitamin B12, or cobalamin, is vital for nerve function and red blood cell production. It's primarily found in animal products like meat, fish, eggs, and dairy. making vegans and vegetarians more prone to deficiency. Symptoms include fatigue, numbness, or tingling in the hands and feet, memory problems, and even depression. B12 deficiency can take years to develop because the body stores it, but once levels drop, the effects can be serious. Regular blood tests and fortified foods or supplements can help prevent this. Vitamin C, known for its immune-boosting properties, is found in citrus fruits, bell peppers, strawberries, and broccoli. It's essential for collagen production, wound healing, and antioxidant protection. A deficiency leads to scurvy, though it's rare today. Early signs include bleeding gums, easy bruising, and slow-healing wounds. You might feel fatigued or irritable, and in severe cases, joint pain or loose teeth can occur. Eating a variety of fruits and vegetables usually prevents this, but smokers and those with poor diets are at risk. Vitamin D, the sunshine vitamin, is unique because your body can produce it when exposed to sunlight. It's also found in fatty fish, egg yolks, and fortified dairy. Vitamin D supports bone health by helping your body absorb calcium. A deficiency can cause soft bones in children, rickets, or brittle bones in adults, osteoporosis. Symptoms include bone pain, muscle weakness, and even mood changes like depression. Many people, especially those in northern climates or with darker skin, are at risk due to limited sun exposure. Supplements are often recommended in winter months. Vitamin E is an antioxidant that protects cells from damage. It's in nuts, seeds, spinach, and vegetable oils. A deficiency is rare but can cause nerve and muscle damage, leading to weakness or impaired coordination. You might also notice vision problems or a weakened immune system. People with fat absorption disorders like Crohn's disease are more likely to experience this. Vitamin K is essential for blood clotting and bone health. It's found in leafy greens, broccoli, and soybeans. A deficiency can lead to excessive bleeding or bruising. Newborns are at risk, which is why they often receive a vitamin K shot at birth. Adults with malabsorption issues or long-term antibiotic use may also be deficient. Eating green vegetables regularly usually keeps levels adequate. Now that we've covered the major vitamins, let's talk about how deficiencies develop. Poor diet is the most common cause, especially if you rely on processed foods or skip fruits and vegetables. Certain medical conditions, like celiac disease or inflammatory bowel disease, can impair nutrient absorption. Medications, alcohol, and smoking can also deplete vitamins. Pregnancy, breastfeeding, and aging increase your needs, so deficiencies can creep in if you're not mindful. So, how do you spot a deficiency? Pay attention to your body. Persistent fatigue, frequent infections, skin changes, or mood swings are red flags. Hair loss, brittle nails, or slow-healing wounds can also be clues. If you notice these, don't jump to supplements right away. Overdoing certain vitamins like A or D can be toxic. Instead, get a blood test to confirm your levels. A doctor or dietitian can help you address deficiencies safely. To prevent deficiencies, focus on a balanced diet. Eat a variety of colorful fruits and vegetables, whole grains, lean proteins, and healthy fats. If you're vegan or vegetarian, consider fortified foods or supplements for B12 and D. If you have a medical condition affecting absorption, work with a healthcare provider to monitor your levels. Regular checkups can catch issues early. Let's talk about supplements briefly. They can be helpful, but they're not a substitute for real food. Whole foods provide fiber, antioxidants, and other nutrients that pills can't replicate. If you do take supplements, choose high-quality ones and follow dosage guidelines. Multivitamins can be a good insurance policy, but targeted supplements are better for specific deficiencies. Lifestyle factors also matter. Exercise improves nutrient absorption and overall health. Stress and poor sleep can increase your vitamin needs, so prioritize self-care. Limit alcohol and quit smoking to protect your nutrient stores. Even small changes, like adding a daily salad or taking a walk, can make a big difference. Before we wrap up, let's address some common myths. First, you don't need mega doses of vitamins to stay healthy. More isn't always better. Second, organic foods aren't necessarily higher in vitamins than conventional ones, though they may have other benefits. Finally, don't fall for miracle supplements claiming to cure everything. Stick to evidence-based advice. In summary, your body is always communicating with you. Symptoms like fatigue, skin changes, or mood swings could be signs of a vitamin deficiency. By eating a balanced diet, staying active, and monitoring your health, you can keep your vitamin levels in check. If you suspect a deficiency, Consult a healthcare professional for guidance. Your body deserves the best care, and understanding these signs is a powerful step toward better health. Thanks for joining me today. If you found this helpful, drop a comment, share this video, and subscribe for more health insights. Stay healthy, and I'll see you in the next one.